Good afternoon. Welcome and thank you all to all the ambassadors for Texas Children's Hospital who are joining us today for the October Ambassadors on Call event, how to talk about tough things with children and families. My name is Fanny Brown, and I'm honored to manage the Ambassadors for Texas Children's program. All of us at Texas Children's hope you and your family are doing well and staying healthy and safe during these challenging times. As we approach our fall season, our traditional holiday party will look a little different as we refocus efforts to giving back to our communities. Save the date for our upcoming Ambassadors in the Community holiday volunteer event, partnering with the Houston Food Bank on Saturday, December 5th. Additional details will follow in the next few weeks. Before I give a brief introduction of our moderator today, let me just cover a few housekeeping items. Today's presentation will be about 30 minutes long, and there will be about 10 minutes afterwards for questions and answers. There will be no video or audio functions for our participants today, but please submit your questions throughout the chat forum. You may do so during the presentation, as Dr. Price will address as many of them as we can during the Q&A portion. Dr. Price was recently named Chief of Psychology at Texas Children's Hospital. She received her PhD from the University of Connecticut, where she also completed a fellowship in clinical psychology. Her patient care activities at Texas Children's focus on diagnosis and treatment of anxiety disorders in children and adolescents. Dr. Price is leading our psychology service in using research and science to provide the highest quality behavioral health care for children and ensuring access to this care for anyone who needs it, regardless of their race, ethnicity, or socioeconomic status. Dr. Price, thank you so much for being with us today. We are all looking forward to learning more from you and the panelists today.
Good afternoon, everyone. Thank you to Fanny and her team for inviting us to be here today in this virtual forum. And thank you all of you so much for taking the time to join us. 2020 has certainly been a history-making year filled with uncertainty and stress and incredible demands on families and parents to help our kids feel okay in a world that doesn't always feel like a very safe place to be. I commend you for being here with us today to discuss how to talk about tough things with children and families. I'm excited to introduce you to three of our incredibly talented Texas children's psychologists, who I'm honored to call colleagues. These professionals are here to share their expertise today and to leave you with practical tips and ideas for having these tough conversations. First, it's my pleasure to introduce Dr. Gia Washington. Dr. Washington holds Master of Science and doctorate degrees in clinical psychology from St. Louis University and a Master of Arts degree in industrial organizational psychology from the University of Houston at Clear Lake. She also earned a Bachelor of Arts degree in psychology from Spelman College. Dr. Washington works with children and adolescents diagnosed with various chronic and acute medical conditions, including sickle cell disease, diabetes, HIV, obesity, cancer, and gynecological disorders. Dr. Washington often provides trainings on multicultural competence, adolescent development, and mental health issues and cultural practices of African Americans. She also serves as the director of the Texas Children's Hospital Parallel Program for Peer Support and is co-chair of the Collaborative on Racial Equity and Inclusion for Black Youth, a TCH Psychology Service initiative. Dr. Washington will be talking with us today about racial and social justice. Along with all of the turmoil related to the pandemic and our upcoming election, it feels like race and social justice are being discussed more often and perhaps more openly than before. These are complex topics even for adults, and we could probably spend an entire day talking about them. But for now, Dr. Washington, what are some tips on how parents can talk with their children about racial and social injustice?
Thank you so much for that warm welcome, Karen. Absolutely, I'm happy to provide some tips on ways to talk about racism and social justice. But first, I'd like to provide a little bit of a context. Questions and confusion about racism and social justice begin early. Young children state their observations of their awareness of differences in skin color, and school children make attributions about ability and opportunity based on what they see around them. Adolescents search for identity and meaning. In all of these stages, your children will ask questions about race and social justice and watch closely for your reactions. I often get asked, how do I start or initiate a conversation about race, about what my kids are seeing? To be honest with you, you won't have to wait too long to initiate that conversation. And honestly, there'll be opportunities that present themselves naturally. Start then. Try to manage your anxiety in the moment. You can imagine being in the grocery store and greeting me. If you're an African American family, your young child might say, wow, her skin is brown like mine. And you might say something like, that's absolutely right. She's African American like we are. If you're not an African American family, your child might make a comment about my skin color as well. It might range from, wow, her skin is very different from mine, or her skin looks dirty, or it's brown. Again, try not to avoid that conversation, but embrace it. That's right, her skin is different from ours. She's African American. Just open the door for the conversation then. That is not offensive. I know sometimes parents get very concerned about saying those kinds of things in a public area. That is not offensive. What appears offensive is the hushing and the avoidance and the awkward silence that follows afterwards. It's totally okay to embrace that conversation for your child. So the best age to start that conversation is honestly as soon as the opportunity presents. But being aware, the conversation will likely evolve and change through your child's stages of development. For instance, in middle school or school-age kids might make references to what we call stereotypes. And that's just based upon their interpretation of the world around them. So they're seeing people of various colors in different occupations or in different jobs and thinking that there might be some type of limitation. Maybe someone would say, I've never seen a Black doctor before. Well, this is a great opportunity for you to interact with me. Maybe they've only seen Black people on TV or on the news just in sports. But that's a wonderful opportunity to dismantle some of that stereotyped thinking. So in adolescence, a lot of them will be reflecting on what does racial identity or social justice mean for me? Who am I? What do I value? That's a perfect opportunity, again, to introduce your family's values, to reaffirm your family's values, and to continue that conversation with your adolescent. Right now, we're being bombarded by images on TV and in social media, definitely in this political season. And so these topics can be very difficult to talk about. You might see this stress present in your child. You might see changes in behavior, difficulty sleeping, changes in mood, or even statements of fear. A Black child might say something like, I'm Black, am I safe? If I run into a police officer, what should I do? If I'm not with you, what should I do? Those kind of questions reflect some anxiety or fear-based thinking. Additionally, a family who's not African American, their child might have an African American friend and then wonder about the safety of that family or parent in that family. So just being able to have these open conversations will be incredibly important and reassuring them. Again, if you're noticing significant changes in mood, that would be a wonderful opportunity to make a contact with the psychology service. We'd be happy to work with your child navigating some presentation in anxiety or fear-based thinking. So the final 3 tips that I want to leave with you all around discussing racism and social justice with your children is 1, to be honest. It's totally okay if you don't have the answer at that time, and it's a very appropriate modeling to tell them, I'm not sure about the answer to your question, but let's work together to try to find it. Another tip is don't avoid the conversation. Even if you're not ready for it right then, acknowledge that. This is a difficult thing to talk about. Let me think about it and let's schedule a date to talk about it this weekend. Something like that can be incredibly effective. And then also take an opportunity to state your family's values. If your family holds strong values around safety, around communication, around friendship, around openness, make sure that your children convey that and understand that. So relying upon these 3 tips will help make things easier for you to talk with your children around racial and social justice topics. Thank you.
Thank you so much, Dr. Washington, for sharing those insights. Next, I have the pleasure of introducing Dr. Ryan Hill. Dr. Hill received his PhD from Florida International University and is a member of the American Association of Suicidology. At Texas Children's Hospital, his work focuses on improving suicide prevention services throughout the hospital, and his research uses technology to enhance the accessibility of suicide prevention services for children and adolescents. Dr. Hill is here to talk with us about suicide and what to watch for. Suicide is the second leading cause of death for children and adolescents in the United States. And according to a 2018 report by the Centers for Disease Control, the suicide rate among individuals ages 10 to 24 increased nearly 60% between 2007 and 2018. Dr. Hill, can you address some of the likely causes for this increase and give our audience some tips and common signs to look for on how to talk with their children about suicide?
Yes, good afternoon, everyone. It's a pleasure to be here today, and thank you for the kind introduction. As Dr. Price mentioned, suicide is now the second leading cause of death among youth and young adults in the US, and the suicide rate has been rising steadily since around the year 2000. I think there are a couple of additional statistics that can really help to put this into context. In a survey conducted last year with more than 10,000 high school students, about 9% of students said that they had made a suicide attempt in the past year. That's about 1 in 11. And almost 19%, or nearly 1 in 5, said that they had seriously considered suicide in the past year. When these same questions are asked of middle school youth, the numbers are actually quite similar, with about 1 in 5 saying that they've had thoughts of suicide. So given the scale of the problem, it's really not surprising that discussions about suicide are happening in the media, in schools, in popular music, and on television. Many of today's new teen dramas include discussions about suicide as a plot point, something that I don't think was true when I was in school. And sometimes these conversations are sensitive, provide resources, and send a message of hope and support to young people. Unfortunately, in the media and on television in particular, suicide is often discussed in a less nuanced, less supportive way. So how do we talk about suicide in a helpful or beneficial way? Well, I think one of the things Dr. Washington said holds true here as well. Don't shy away from the topic, because that sends a message. Avoiding the topic of suicide just tells young people that suicide is not an okay topic to talk about, or that we just don't really want to know what they're thinking. And obviously that's not the message we want to be sending to youth. One of the things I often say when training clinicians in how to assess for suicide risk is to say, suicide is not a curse word. You won't get in trouble for saying it. In fact, if you don't actually say the word suicide, then you didn't ask about suicide. So what you have to do really is be fearless, or at least pretend to be fearless. When it comes down to it, the only way to talk to youth about suicide is to straight up ask. And if this is a new, uncomfortable topic for you, that is completely understandable. You might start with the discussion about mental health or expressing emotions. It might be helpful just to start having these conversations in order to open lines of communication so that you can talk about suicide in the future. For teens, this might sound something like, I know you've been feeling really overwhelmed lately. Can we talk about it? And then asking, have you had thoughts of suicide at all? For preteens, it might sound more like, it looks like you've had a rough day today. Are you feeling sad? Can you tell me what's making you feel that way? When you feel sad like this, do you ever think about suicide or killing yourself? And these questions are very blunt, but as I said, that's part of being fearless, and you just have to dive in. And one of the worries that many people have is, are we going to somehow give kids the idea of suicide? In other words, is asking about it going to cause suicidal thoughts? And I can answer that concern with confidence because there have been multiple carefully controlled studies and they all say the same thing. Asking about suicide does not cause suicidal thoughts. As it turns out, most youth who think about suicide are looking for help. They might be feeling sad or depressed. They might be worried or anxious about the pandemic, about school, about things they see in the news. They might be feeling stressed or overwhelmed by everything that's happening or by the pressure to do well. They might be having trouble in their friendships or have just experienced their first heartbreak. But most often, if they are having thoughts of suicide, they want to talk about it. They want help. The reality is, though, that most teens have never been asked. So the first step is to ask about suicide. The second step is a bit easier. Once you've asked, just listen. Don't interrupt, don't minimize it, and above all, don't dismiss it. And at first, Resist the urge to problem solve or to give advice. Just listen. And when you've listened and really heard what your young person has to say, then you get to the third step. Help them find the help that they need. We don't want to put the responsibility on you. That's what the mental and behavioral health professionals are for. So reach out to them. Use those resources. If it's a crisis situation, stay with that person and call the National Suicide Prevention Lifeline or message the crisis text line. If you don't know those numbers and you don't have a phone to look them up, call 911 or go to your nearest emergency room. If it's not an emergency, help them find a behavioral health provider. Maybe offer to help call therapists with them, or if it's not your young person, offer to help have the conversation with their parent to help them get connected. We have treatments and programs that work, but they only work if you come see us. So start the conversation no matter how uncomfortable it is. Don't assume it's something that happens to other people. Ask, listen, and seek help. And in doing so, you're going to help spread the message that suicide is something it's okay to talk about. And with that, I'll turn it back over to Dr. Price.
Thank you, Dr. Hill, for helping us to feel a little bit better about what's such a hard and sobering topic to think about when we think about our children. Our third speaker today is Dr. Ginger Cline. Dr. Cline received her PhD from the University of Kentucky, and she completed an internship and fellowship here at Texas Children's and Baylor College of Medicine, focused on pediatric psychology. Her patient care activities at Texas Children's focus on helping children cope with a variety of medical conditions, with a specialty in traumatic stress and adjustment following accidental injuries. Dr. Cline is also a highly valued member of the limb deformity and limb deficiency clinics, as well as the pre-liver transplant team. She's actively involved in training where she enjoys providing supervision and direct teaching experiences for learners in psychology and in pediatric medicine. Today, Dr. Cline will be talking with us about helping our children grow after the stress of 2020. To say that 2020 has presented unprecedented challenges for children and families is certainly an understatement. Dr. Cline, can you talk about some healthy ways to cope with all of these stressors and how to find hope for the future despite our current challenges?
Sure. Thank you for that introduction, Dr. Price. And just a disclosure at the beginning, I unfortunately do not have a magic wand. That is something we often tell families we wish that we did. We could wish this year away. But with that in mind, I hope to give some thoughts or feedback about ideas of things that can help. And the very first one is just to acknowledge that our feelings, whether that's frustration or worry or sadness, those kind of pieces are all really normal reactions to these abnormal situations. And we've had so many this year. And so it's important to normalize that. It's important to express those both as parents, but also for our children. So we often give the analogy of on the airplane, they always say parents, put the mask on yourself first. It's the same way. If we are not taking care of ourselves, we're less able to take care of our children. And we also have to think about modeling for our kids. And so we want to model for them. These things are hard, and this is how we're handling this as a family so that they have that to work on. So whether that's talking about feelings with other people, exercising to get it out, picking up Zumba, prayer, drawing, volunteering, all kinds of different things are ways to kind of help express a lot of those emotions. And then again, to help with our children. And then like Dr. Hill said before, active listening is really the next most important step. We want to make sure that we give our children that same opportunity that we're taking ourselves. So we want to be thoughtful about avoiding the yes, buts. So yes, this is hard, but let's look at it this way. We want to give them that same ability to have that feeling. So what that might look like is active listening is sort of reflecting back. Doesn't mean you necessarily agree, but you're validating what they're saying. So you might hear, this is the worst year ever. I never get to do anything. And how you reflect that back is you're really frustrated by all the challenges this year. You're letting them know that you've been heard. And then the next step after that, besides, as Dr. Hill said, is just sort of waiting and giving them time to get all that out, is then to ask, what are your thoughts? What should we do? Before we jump in as parents, there may be times that they don't know what to do. And so giving some advice can be helpful, but especially as our kiddos get older, asking for some of that permission is like, would you be interested in some help? Or again, seeing what their ideas are first, which gives them this sense of self-efficacy and agency, which is really important in these uncontrolled kind of situations that we have popping up this year. Also, just generally responding to questions honestly at a developmental level and actively planning for check-ins. So we don't, again, just sort of assume and move through each day, but when things pop up or on occasion, just check in and see like, hey, I'm just curious if you've been thinking any more about this that happened, anything else you want to talk about that. And then also maintaining some normalcy where possible. So having routines as much as you can, even if they're new routines, having expectations. This is really hard that you can't do trick-or-treating or whatever this year, and you still have to pick up your toys. So it's kind of those things that, again, allow some normalcy in the moment. They may not appreciate it, but down the road, that does help with stability. The next idea is just the idea that when there are stressors generally, there's sort of two main approaches that you can approach. And I like the serenity prayer, I think, regardless of anyone's faith background, I think sort of states that well. And that's the grant me serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And so the first part is that changing part. So that's the problem solving. Are there things that we can do to fix whatever the situation is, or to make it safer or less stressful? So for example, with COVID, we can wash our hands, we can wear our mask, we can socially distance, we can do all those things in a way to help keep us safe. For hurricanes, can we prepare a kit? Have we talked about an evacuation route? Those kind of pieces. For racial injustice, is that something we can talk about in our family? Can we read books? Can we join a book club? Can we protest? Are there things in that realm that Dr. Washington talked about to be able to pull in things that we can help in that area? Those are pieces on the problem solving side. On the other side, this is sort of an old song, but it sort of helps me think about this one, is the Stephen Stills. So if you can't have the one you love the one you're with. I'm being a little facetious. We don't love, I'm not encouraging you to love the situation right now, but this is that idea of accepting. So if I can't change it, then I just have to cope with kind of the situation that we're in. So some things are distractions. So limiting TV viewing, getting updates, but making sure that is not the continual message or stressors that we're seeing at home. Doing enjoyable things, exercising, again, as a family, modeling that for your kiddos. Teaching relaxation. So younger kids, a lot of times we'll talk about pufferfish breathing, so kind of the stomach in and out, or sort of smell the rose, blow out the candle. So kind of teaching some of those strategies. Also progressive muscle relaxation, some ways, again, just to kind of handle the physical symptoms of stress. We'll also talk about mindfulness. So the idea of maybe thinking about clouds in the sky. So each sort of thought or feeling or even event in 2020 that kind of comes through, at some point it will end, and trying to think about this is just sort of there. I'm seeing it. I'm letting it go. I'm not going to try to not have too much emotional attachment to that. And another example I really like, someone shared with me, is like a jar with water and glitter. If you shake it around, everything sort of gets stirred up. But if you wait long enough, things do settle. And so I think that sort of vision may be helpful too, to kind of help us in those moments. We also sometimes will encourage playing like the game of 5. So it's a way to ground yourself with where you are instead of being overwhelmed by everything around. So think of your 5 senses. What are 5 things in this moment? I'm feeling really stressed. I can see. What are 5 things I can hear or smell or touch, or all those different senses that you can have? That's one way to sort of have a present focus and let some of those other stressors go in that moment. And then also just changing our thoughts. And sort of 2 main rules I like for that is it true or is it helpful? And if you say no to either one, then we encourage you, just like you change the channel to something else, you might change the channel in your thought to come up with something that is more helpful or more true. So an example would be going from I'm going to get COVID, for example, to I'm taking steps to stay healthy. That again is the same situation, but it's a more helpful thought in that situation overall. And then I also like just adding sort of the growth mindset to that. So the power of 3 letters, yet. So I think if we add yet to a lot of our thoughts or pieces that we have, that sometimes helps us maintain that hope piece, which is so important. And that's where I want to end today, is the idea that even in these really hard situations, and again, this is not ignoring that part, we have to express that and acknowledge that part, but there can be positive changes. There are silver linings sometimes that happen from this. So these are things like some of the initial environmental changes that happened when everybody had to lock down. There was less pollution or those kind of things for a while. Families got more time together. Faith growth perhaps in these situations, or reordering priorities, more of a focus on kindness and ways that I can do something to help somebody else. Those are all great ways, again, to have some control and some hope in those situations. And we also want to remember that even if we could, we wouldn't necessarily want to protect our children from all hard things. Granted, we would not choose as many hard things as we had this year, but The idea with hard things, especially if we are modeling and supporting our kiddos as they go through, is that they learn how to handle this. They learn I can handle hard things, and I can draw on that for the hard things that will come in life. That's just part of life overall. And so I think kind of reminding ourselves about that can be really helpful as well. And then just intentionally focusing on growth, on hope, talking with your kiddos, thinking yourself about what are some positive things that have come out of this so far, and or things that I could do. Are there, again, volunteer opportunities? Could I pay for the person's food behind me? Are there ways to kind of pass those things forward just to lighten the load that we all have overall? And then I think finally, just maintaining that focus on the future. Yes, we want some present focus at times when we're feeling overwhelmed, but for our seniors this year, or our younger kids who are looking forward to holidays or birthday traditions or those kind of pieces, we still want to plan for those things. We still want to talk about those and have those traditions, and kind of be planning for those parts that, again, bring some normalcy to the conversations and the thoughts and pieces that they have. So I appreciate your all's time today, and thank you, Dr. Price.
Thank you, Dr. Cline, for that message of hope, and thank you to all of our speakers today. I hope that all of our participants gained some really useful information about ways to address these very difficult topics with their children and with their family members. Now we'll proceed to the Q&A portion of our presentation. It looks like our first question is for Dr. Washington. Dr. Washington, how do you clear up misinformation sometimes portrayed in the media?
That's a great question. I think this would be a great skill for your kids to learn. When they bring something to you and you wonder about the validity or the truth about it, taking the next step and showing them, well, let's look this up. Let's see if there's any fact around this, or if there's any historical context maybe this is coming from. Actually going through with them, sitting down with them in front of the computer, typing in whatever the question might be, and perhaps, looking for a book at the library or something like that, to really show them that we'll take this a step further, especially if something isn't settling well with us. We'll try to find the answer and we can work on it together.
Thank you so much. Maybe a follow-up question for you, Dr. Washington. If we ourselves are not part of a minority group, but we want to ensure that our family are allies, what are some productive ways to educate and be proactive in the cause? How can we help?
Oh, that's a great question. There are so many ways to do that. I think one of the things that I would encourage families to do first is something very simple. Maybe starting with a conversation within your family. This is an important value of ours. We have friends and family who are all different colors and races, and we want to make sure that we communicate to them, that we love them, and that we are in support of them. Let's sit down tonight and think of some ways that we can do that. I mean, really having that as a topic or as an idea for your family to all weigh in on. I think that's a nice thing because, kids know a lot about things that their friends might appreciate or ways that they can communicate. And that takes a little bit of the pressure off of you to always have to have the answer. But there's certainly a lot of things that you can do, again, as a family, a book club, a movie night, an experience. There's lots of places in Houston. We live in such a rich, diverse community. There's so many opportunities to engage with different cultures, visit different restaurants, be parts of different faith communities, so many different things that we can do. I think the main point is, though, allowing for that, setting up some time in your family. It could be a monthly activity or a bi-monthly activity, but sitting down with your family and establishing a commitment to do that. So not only an activity, but one other thing I'll add, also a commitment to some level of intolerance of racial prejudice or discrimination. So you're teaching your kids and you're committing with your partner that we're not going to, endorse race-based jokes or things that can be hurtful. We're not going to model that behavior in front of our kids. We're not going to think that it's funny and sort of permit it around us. And you might also have to model for your children how to set a boundary, what to say to someone if they say something to their friend that's inappropriate, or they feel insulted or offended by witnessing this joke or this comment. Really modeling for them. I don't really like that. I don't feel comfortable with that. And I don't really want to play this game anymore because of that. Just teaching them specifically what to say can be incredibly powerful. And that's a wonderful way to be an ally.
Thank you so much, Dr. Washington. Here's another question that many of our speakers may be able to comment on. So how early should we be starting these conversations? What age is too young? I'm wondering, Dr. Hill, if you'll start.
Certainly, I think that when it comes to having conversations about emotions and how to express emotions and using those emotion words, we can start as young as kids are able to understand words like happy and sad, and sort of advancing our language as they get older. In terms of the more specific conversations around suicide, I think anytime you're noticing, sort of regardless of the age, things like bullying, victimization, those sorts of things, probably doesn't hurt to ask. And asking a couple of times isn't going to hurt things either. As I said, you're not going to give them the idea. But then definitely sort of by late middle school, I think that's probably the ideal time to start asking, because that's really when we see most kids start to think about suicide, as sort of that middle school age range.
Can I add just really quickly? I was just thinking of recently in one of my clinics, the LIM clinic, just seeing actually a 2-year-old little girl who had already started noticing some differences between her physically and other kids. So again, I think when we're talking about differences in those pieces, again, even a 2-year-old notices some of the things. And again, having those conversations just models to them that this is something open that we can talk about.
Dr. Washington, would you add anything in terms of when is the right time to start talking about issues related to race and social justice with our children?
Again, I would say as early as possible. There will be so many opportunities to have difficult conversations with your kids around so many topics. But certainly race and social justice will come up pretty early. Even 2- and 3-year-olds have a really strong concept of fairness, and that's essentially what social justice is. So starting and encouraging conversations around, what's fair, what's right, what might result in someone feeling a particular way based on an action, that's all in support of conversations around racial and social justice. So there's lots of opportunities. And I think once you start that conversation, it will evolve over the age span, and there will be many more opportunities as well.
Thank you for those great responses. We have a few questions for you, Dr. Hill, related to suicide. One of them is lately there have been really young age groups committing suicide, as young as 8 years old, due to things like bullying in school and exposure to social media. How do you intervene when we're talking about these young children?
Yeah, I think that's really a great question. When it's things like bullying, I think certainly we just need to have a stance that that's not acceptable at any age. And so working with schools to make sure that that's not happening, or that we put an end to it when it does. Things like social media, I think that's a personal decision that every family has to make about when kids are going to be allowed on social media and which kinds and to what extent. But certainly keeping an eye on it and monitoring it and making sure that you know what's happening on someone's social media feed is a great idea. So I think at that age, it is more sort of looking at the things that are going on and asking whether or not that's appropriate for kids at that age. And things like bullying are never appropriate. Social media changes at different ages. I think that it's obviously incredibly sad when we hear about those deaths. Nationwide, they are still quite rare. So a little gem of good news is that it's still very uncommon. But yes, definitely keeping an eye on things like bullying at that age.
So kind of related to that, thinking about media more broadly, should we allow our children to watch TV shows that are displaying suicide as part of the plot? Is that a good way to introduce the topic? Are there better ways to introduce the topic?
I think regardless of whether or not it's a good way to introduce the topic, it is happening. So I don't think that I would disallow those kinds of shows if they were my own kids. I think that's popular television is often something that we connect with other people about and we have great conversations with our peers about. And so I wouldn't want to necessarily shut down those opportunities. But I think perhaps pairing those television shows with a good conversation about what they saw. So things like, you know, what could the characters have done differently? Or do you think they did a good job of portraying that? Or, you know, if one of your friends were feeling that way, what would you have done? Are all great ways that we can sort of discuss what we're seeing and try to put that more beneficial spin on it.
Great, and just one more question for you, Dr. Hill. What if your child doesn't open up? How do you create the dialogue? When should we bring in outside help that doesn't feel too intrusive? And should it be a family effort? Should it be a one-on-one with a parent? How should we handle that?
Sure. I think if you're feeling like your child isn't opening up to you, then definitely try to look for other ways to get that information, right? I think having it be a family effort is a great idea. Sometimes kids aren't comfortable talking to their parents, but might be more comfortable talking to their grandparents or their aunts and uncles, or a cousin that's already. Maybe it's a school counselor that can check in with them, or even your children's best friend's parents. I made that connection correctly, right? Just any adult that they're willing to speak to, maybe you can loop them in and get them on your team.
Great, thank you. We have a question for you, Dr. Cline. So with COVID changing so much about how we interact with friends and families, how do you help transition to the new norm, especially during the upcoming holiday season?
That's a great question. And I think trying to keep in mind some of the recommendations I spoke about. So first is to not jump right into problem solving mode. I think first is to just express, this is stressful, I'm going to be sad, we're not able to do this usual trip or see family or do the trick-or-treating party or whatever it might be. So it's to allow them and kind of check in with them, like, how are you feeling about this? This is kind of what we're not able to do this year. Let them express that, validate that feeling, very important. And then talk about, again, try to get their input first. Doesn't mean you have to do their first or second idea, but get their input about ideas of a new tradition maybe to try. So similar, it sounds like, to the ambassadors on call, it sounds like typically there may have been a holiday party, but that maybe this year it sounds like you all may be doing a volunteering event. So are there ways that you can substitute in your family and problem solve different ideas of things that might be of interest? So instead of trick-or-treating, if your family trick-or-treats typically, is there a way to have a costume party within your family, or even to connect that with family members or friends via Zoom and having, again, costume contest, all those different things? Can you find a really fun recipe to try out and cook at home? Can you go to a drive-in movie? Again, anything that your family particularly may enjoy, trying some way to still have that experience, but in a different way. And so I think that's one part. Again, we want to give space to, it's disappointing we're not doing this, and yet we can do some other things to have that tradition. And I think there are ways, this isn't necessarily for holidays, but I've been impressed. I have a teenage daughter, and so they sometimes might do Zoom fancy dinners. So are there ways, again, to build in some social activities just here and there? No reason to get dressed up or do their hair or whatever that way, but it's a kind of a fun event and way to maintain some of those connections that are just not able to be part of the norm right now, and that applies to family as well. My other daughter has on the phone continually, but with cousins, and so it's a really nice way, even across state lines, for them to be able to interact and maintain some of those connections that we won't be able to have this year because of the holidays.
Thank you so much, Dr. Cline. Those were some really great ideas. Dr. Hill, I have a question for you. A 9-year-old child of a family friend recently committed suicide. We're struggling with whether or not to tell our children, who are slightly younger, the actual cause of death. Do you have any advice as to the best approach in this type of situation?
Yeah, that's definitely a difficult question. And unfortunately, I'm not going to give you a straight answer because I think it's a little bit different for every family who might have to encounter this. In part, I think it depends on whether or not you think your children would understand what that means and what kind of language you're using. If they're asking questions about it, I tend to favor telling the truth and being open, but sort of at their level of understanding. If they're not asking questions about it, now may not be the time, but that may come up later, and just know that that's something that may come up later, and you may have to answer it a couple years down the line. What I can say is that there are 2 great organizations to check out for literature on this for suggestions on how to talk to kids. One is the American Foundation for Suicide Prevention. They have a fantastic website full of information, even into little courses that you can take that are like an hour long, and also the American Association of Suicidology. So both of those are places that have lots of resources.
Sort of a follow-up question, Dr. Hill. You suggested using the word suicide specifically, but we have an audience member asking whether there's any downside to using phrases like, have you ever thought about hurting yourself, and not using the word suicide specifically?
Yeah, that's another great question. I did mention also, I think, perhaps using the phrase killing yourself instead of suicide, or alongside, sort of pairing those together. And I think that's a pretty good substitute because it's very clear what it means. One of the things we do find occasionally, though, is that hurting yourself can have a different meaning. It's another important question to ask because it can sort of pull for things like harming yourself or cutting or burning or things like that. But it's not quite the same thing. And we have occasionally seen kids who will say, no, I'm not thinking about hurting myself. And then when you ask them, say, oh, I am thinking about killing myself. I think I've found a way that's not going to hurt. And so they can honestly answer no when that's not quite the question you were trying to get at. The other thing that I think trying to find a substitute does is it gives the impression that we're not comfortable talking about this. And that's sort of, I think, been one of the themes of all of our talks today is you just have to dive in and have the conversation. There's not a silver bullet for making these conversations easy, but sort of modeling that you're willing to have a difficult conversation can be really good.
We have a question for you, Dr. Cline. One of our audience members has a child who's now more anxious and afraid to go out in public because of the fear of getting COVID. How can parents help, especially when it's time to go back to school?
That's a great question. I think your kiddo is likely in very good company with other kiddos, but some adults as well. And I think it definitely, again, to validate that concern is important, and it's different now than it was before. So clearly, if we had kiddos who were concerned about germs or those kind of pieces in the past, we may have had a slightly different approach or speed of approach for kind of supporting them of being brave and getting out there. But I think this is where we come back to, we validate feelings first and let them express that. And then we see what ideas they have. So again, letting them come to that table first, but then we may help problem solve and give some information. And so for one part of that is, as a family, there are certain things that we feel safe doing. And again, each family is sort of different within, what level of things that they're needing to follow from there. But here are the things that we're doing to stay safe. And so if me as your mom or your dad or your grandma or grandpa is taking you out, then we're feeling okay about that. So we're washing our hands, we're wearing our mask, we're staying away. This is what our national, state government is kind of talking about. Again, you can go into that level of detail depending on the age. And then what we do is we practice. So it's kind of like, I like the example of a cold pool of water. So at first you jump in, it's freezing and you want to get out. But if you stay in, you get used to it, right? The water temperature is the same, but we get used to those things. And so if it's going to be something that child will need to be doing, we need to start giving them practice about going out and trying those things, again, in safe ways. And then oftentimes, depending on the age of the kid, though even older kiddos like rewards too, but rewarding bravery. So whether that's by praise, specific labeling of things, I am so proud of you, you were scared and you went out with us anyway, to bravery bucks. Those are things we use a lot around here. Things that they can trade in for privileges. Doesn't mean you have to buy something, although maybe you need to go to the store and buy that something. There's another opportunity to get out there and expose the kiddo. But I think kind of letting them know generally for those pieces, and then if it is related to school, once you get that information from the school sort of about what are their procedures, advanced preparation is always helpful. So here's what we think it's going to look like for the school. There may be some changes here and there, but generally this is what we're going to start off with, we think, on day one. And we know, again, teachers' job is to also keep you safe, and then doing, again, bravery, reinforcement, those kind of strategies.
So here's another question. I'm actually going to pitch this to you first, Dr. Washington, from an adolescent perspective. How do you empower kids that don't want to do social media and TikTok when it seems like everybody else does, and then it becomes socially isolating to not participate?
Oh, that's an amazing question. Thank you for pitching that to me. That's certainly, I could understand the weight and maybe even the worry behind that, right? Because right now, social media participation, TikTok videos, etc., are social currency. Whether you're watching them, whether you're participating in them, making them, all of that sort of has social currency and meaning. It's a way for us to connect. And if your adolescent or preteen is someone who's really just not into that, that can be very isolating because in some way it is separating them from other people who are really into it. And we know the trend among this age group is to be producing that kind of thing. So two things I would suggest. One being, if your child is not interested in that, maybe showing them some ways to amplify what their interest is. So they're really into their sport, or they're really into their craft, or to their violin, whatever it is. Showing them that they still have something that's a great social currency, and they're developing a skill or a talent in this other way. Another thing I would suggest would be maybe doing some role play with your child for what to say when kids ask, well, why aren't you on Instagram? Or I am trying to find you. Where's your profile? Or why didn't you comment on my TikTok video? Helping them get some statements or some words in place that they can say kind of at the ready when those things come up in their peer group. And making sure that it's something that won't be misjudged as judgment. So you don't necessarily want your child to say, I think that's stupid, that's why I'm not on it, right? Because the receiver might think or hear, oh, you think I'm stupid because I'm doing this. And that could, of course, create more kind of a social disruption. But maybe them saying, oh, I'm just not really into it. I'm totally into this other thing, or I don't have time. I also sometimes encourage adolescents and their parents to sort of blame their parents a little bit. Like, my parents won't let me. They've reduced my screen time and I just can't really do it. That's another way for them to sort of get out of that responsibility in that conversation. But I really appreciate this conversation because I'm sure as a parent, even though it might be difficult to see your child isolating, I think you can be quite proud of your child and quite proud of your parenting if they're willing to go against the grain, if they're being true to themselves and true to their interests. And that means that you're really raising an empowered and strong teenager.
I think we have time for one more question. Dr. Cline, this one's for you. How do you help young children understand why you don't let them do things that their friends are doing? For example, their friends might be going to the park or having play dates, but as a family, we're not comfortable with that. How do we help them understand that they need to be safe, but they still feel left out?
Yeah, that's a great question. And I think that's a hard one because as you mentioned, as we all saying, families have different levels of comfort and sort of how much they're following certain pieces, whether that's health reasons or just sort of their understanding of guidance that's coming out. So I think in those situations, again, not to continue to harp on that point, but just to reflect, like, that is hard. And I understand that part. So we're not trying to argue them out of feeling left out. That's a valid reaction in that situation. And then I think it's just sort of those education and talking with them, again, at whatever developmental age. It sounds like younger kids, but parents make lots of different choices for kiddos. So whether that's based on faith beliefs, like some families celebrate different holidays or celebrate birthdays or not, or some families let their kiddos have cell phones at certain ages and some families do not. Some families have more specific rules on diet food choices as far as desserts and whatever they're having choice. Some are less so in that area. And so I think that's, again, another great opportunity to talk about differences, and families see the world in different ways. Families have different scenarios that are true for them that we may not know and they may not know about us. And so giving that information, but as I mentioned, just making sure to validate the feeling and then see what ideas they have as they're, this is really hard. I'm wondering if you have any ideas on what could we do to help you feel better today? Like, what could we do as a family that maybe isn't like the park, but it might be kind of fun all the same?
All right, thank you so much for all of the guest speakers today. We were all in for a treat. And thank you all for those who submitted some really good questions that I hope that you take home with you and are able to utilize at home with your families. If you would like more information on any of the topics discussed today, or if you have any additional questions that you weren't able to ask, please feel free to email us at ambassadors@texaschildrens.org. Thank you and have a great afternoon.